Welcome to another deep dive. We're tackling a topic that can be a bit, well, heavy. Cancer prognosis.
Yeah, it can be a lot, can it? But it's so important.
Exactly. We're going to break down some excerpts from the National Cancer Institute's insights on cancer prognosis.
A great resource, by the way.
You're sure. And hopefully by the end of this, you'll feel a lot more informed, like really equipped to understand this whole landscape.
Because knowledge is power.
Right. Absolutely. So first things first, what exactly is a cancer prognosis?
You know, it's basically an educated guess about what might happen during your cancer journey.
Okay, so not a fortune teller.
Right, not a crystal ball. More like a weather forecast based on, patterns.
Informed by data, but not a set-in-stone prediction.
Exactly. There are a whole bunch of factors, and those vary from person to person.
Got it. So what are some of those factors that can influence a prognosis?
Well, you've got the type and location of the cancer. Those are huge. Some cancers are just naturally more aggressive.
Like if it's a fast-growing tumor
Right.
versus a slow-growing one.
Yeah, exactly. And location matters too. Like a tumor in a vital organ is going to be different than one in, say, a less critical area.
Makes sense. Different cancers, different behaviors.
And then you've got the stage of the cancer. That's telling us how far it's spread.
Kind of like a map.
Yeah, exactly. The further it's traveled, the more complex it gets.
So early detection is crucial then.
Oh, absolutely. And then we have the grade of the cancer.
What does that tell us?
Well, they look at the cancer cells under a microscope, see how abnormal they are.
So they're literally analyzing those cells for clues.
Exactly. It gives them an idea of how likely they are to grow and spread. It's like assessing their personality.
Fascinating. Anything else?
Yeah, your age and overall health come into play too.
Right, because pre-existing conditions can affect treatment, right?
Exactly. And also just how your body might react to treatment. Some people sail through chemo, others have a tougher time.
Totally. It's all about that individual context.
And then, of course, there are the survival statistics.
Ah, yes. Those can be kind of scary, can't they, those numbers?
I know. But they're important to understand.
Can we break those down a bit? What are the different types of survival statistics?
Sure. First, you might hear about cancer-specific survival.
Okay, what's that?
It's the percentage of people with a specific type and stage of cancer who are alive after a certain time, but it's only looking at deaths caused by that cancer.
So it's focused on survival related to that specific cancer, not other things.
Right. Then there's relative survival.
What's that one?
It compares the survival of people with cancer to people without cancer.
So it puts those statistics in context.
Exactly. Helps us understand how cancer impacts survival compared to, what's considered normal.
Makes sense. What else is there?
Well, you've got overall survival.
And that is?
A broader measure. It includes all causes of death, not just the cancer.
Okay, so a bigger picture of how long someone might live.
Yep. And lastly, there's disease-free survival.
Disease-free. I like the sound of that. What's that one all about?
It's the percentage of people who stay cancer-free after treatment.
So it shows how effective the treatment was at getting rid of the cancer.
Yes.
Right.
Exactly.
But it's important to remember that those statistics, they're based on large groups, right?
Oh, for sure.
They show trends, not individual predictions.
Absolutely. Every journey is different. Those numbers are a starting point. They don't tell the whole story.
Right, because everyone's unique. And speaking of not telling the whole story, there's another area that I think causes a lot of confusion.
Oh, yeah. What's that?
The difference between being cured and being in remission.
Yeah. People mix those up all the time.
They do.
Yeah.
So can you lay it out for us? What's the difference between a cure and remission?
All right. So a cure means there's no detectable cancer after treatment, and it's unlikely to come back.
Okay, so like a clean slate.
Pretty much. Remission, on the other hand, means the signs and symptoms have decreased or even disappeared.
But it doesn't necessarily mean the cancer is gone.
Right. Remission can be partial or complete.
What does that mean?
Partial remission is when the cancer has shrunk, but it's still there.
So it's like it's taken a step back, but it might still be lurking.
Yep. Good analogy. And then there's complete remission. That's when all the signs and symptoms are gone.
Oh, wow. Sounds pretty promising.
Yeah.
So does that mean it's gone for good?
Not necessarily.
Mhm.
Even with complete remission, doctors might not use the word cure, especially in the first, 5 years or so.
Really? Why is that? If it's undetectable, I think you're in the clear.
Well, sometimes microscopic cancer cells can still hang out. even if we can't see them.
Oh, wow. So it's like a tiny seed just waiting to sprout.
Kinda, yeah. So even in complete remission, there's still a chance it could come back.
That's got to be tough to deal with, knowing it might come back.
It can be, yeah. That's why monitoring is so important, even after complete remission. Checkups, scans, blood tests, the whole 9 yards.
So it's about staying vigilant, but also, I guess, understanding that even with remission, life can go on.
Absolutely. In fact, quality of life becomes even more important.
Right, because it's not just about fighting the disease, it's about living well.
Exactly. And that's where those self-care practices come in, the things we talked about before.
Like what kinds of things?
Well, eating a balanced diet, lots of fruits, veggies, whole grains. Give your body the nutrients it needs.
Makes sense. Fueling the army. What about exercise?
That's huge too. Even gentle movement helps with circulation, mood, energy levels. Even a short walk can make a difference.
And I imagine stress management is important. Dealing with a cancer diagnosis, that's got to be stressful.
Oh, yeah. Things like mindfulness, deep breathing, spending time in nature, all those things can help.
Finding those pockets of peace, right?
Yeah.
In the midst of everything.
Exactly. And don't forget connection, talking to loved ones, support groups, even online communities.
Because you're not alone.
Exactly. And remember, this isn't about just accepting your prognosis. It's about understanding the information, asking questions, working with your doctor to make a plan that works for you.
So it's a partnership, not a dictatorship.
Exactly. Your doctor's there to guide you, but you're in control. All right, so we've covered a lot of ground here. What prognosis means, the factors, those survival stats, the whole cure versus remission thing. But before we wrap up, I want to leave you with a question.
Ooh, I love a good question.
Knowing what you now know about prognosis, what steps can you take to be an active participant in your own health journey?
That's a great question, because it really is about empowerment, isn't it?
It is, and it starts with understanding those statistics, those survival rates we talked about.
Yeah. Let's go back to those for a minute. I think it'd be helpful to see how those numbers play out in like a real-world example. Can you give us one?
Sure. Imagine 2 people, both diagnosed with, let's say, breast cancer.
Got same cancer.
But one person is diagnosed early, stage 1. The other person is diagnosed later, stage 3.
So different points in the progression.
Right. Their 5-year relative survival rates might look totally different.
How so?
Well, the person diagnosed at stage 1 might have a 95% 5-year relative survival rate, meaning statistically they're very likely to still be alive 5 years after diagnosis.
That's good news.
Right. But the person diagnosed at stage 3 might have a 70% 5-year relative survival rate, meaning their chances are lower.
Wow. So the stage makes a big difference, statistically speaking.
It really does. But remember, these are just statistics. They don't tell us what will happen to any one person.
Right. Everyone is different.
Exactly. That's why it's so important to understand your individual situation. Talk to your doctor, understand those factors we talked about, and then make decisions about your treatment and care based on that.
So it's about personalizing those statistics.
Exactly. And remember, those statistics are always changing. As medical science advances, what might have been a bad prognosis a few years ago might have a much better outlook today.
That's a good point. There's always hope and new possibilities. But even with all the advances, I think the emotional side of this can't be ignored.
You're so right. A cancer diagnosis, even with a good prognosis, can be really emotional. Fear, anxiety, all of that.
So what advice would you give someone who's struggling with all that?
Talk to someone. Don't keep it bottled up. A partner, a friend, a therapist. Support groups are great too. Sharing helps.
Like I say, a problem shared is a problem halved.
Exactly. You're not alone in this. There are so many others who have gone through it, and there are resources available.
Like those support groups you mentioned.
Yep. And online forums, even apps now. It's a whole community ready to help. So reach out, connect, and remember, you're stronger than you think.
That's great advice. Well, folks, we've come to the end of our deep dive into cancer prognosis. It's been quite a journey. We talked about what prognosis is, those survival statistics, that whole cure versus remission thing.
It has been a lot, but hopefully our listeners feel a little more equipped to understand it all now.
I think so. Knowledge is power. Even when things feel uncertain, there are always things you can do. Ask questions, find support, and advocate for yourself. Until next time, keep diving deep and keep learning. It's a lot to take in for sure, but yeah, hopefully it's helpful.
I think so. You know, even with a good prognosis, it can still be scary. I mean, just hearing the word cancer.
Absolutely. And then having to rewrap your head around all this other stuff, the statistics, the treatments,
Yeah,
everything.
that's a lot.
Yeah.
And every case is different.
Right. Which is why it's so important to have those open conversations with your doctor.
Oh, absolutely. They're your partner in all of this. Ask questions, get the information you need, and don't be afraid to advocate for yourself. You deserve the best possible care.
Couldn't agree more. And remember, even if you have a tough prognosis, there's always hope. Medical science is constantly evolving.
That's so true. What might have seemed like a dead end a few years ago could have a whole different outlook today. New treatments are being developed all the time.
Exactly. Never give up hope. Well, folks, that brings us to the end of our deep dive into cancer prognosis. We covered a lot of ground, from what prognosis even means to those sometimes scary survival stats.
And that whole cure versus remission thing, which can be a bit confusing.
Yeah, there's a lot to unpack, for sure. But hopefully you're walking away feeling a little more empowered, like you've got a better handle on all this.
That's the goal. Knowledge is power, right?
Absolutely. And even when things feel uncertain, there are things you can do to take control. Talk to your doctor, ask questions, find support. You're not alone in this.
And never stop learning. There are so many resources out there to help you navigate this journey.
That's right. Until next time, keep diving deep and keep learning.